Hi, my name is Britley Harrison, and I'm doing a project on wound care. Today's date is 7/21/2024, and wound care and the impact on patient's outcome. There are many impacts on the patient whenever they have wound care. The patient's quality of life is impacted. The wounds worsen and can cause infection, and nutritional status is a big problem whenever they have wounds. They have protein that needs to be given to help heal the wound. Wound care can be reduced by pain, anxiety, and improve the overall quality for a patient's life. Treatment affects the daily life, emotional well-being, and ability to engage in normal activities. The objective of this project would be to have wound care to help the patient with their wound healing. They have many comorbidities, such as diabetes and obesity, which can cause their wounds to worsen also. So I am wanting to talk to you guys about wound care and to help decrease the wound and decrease the infection of wounds. You need to decrease the wound size, drainage, and decrease the infection. You want your wound to heal quickly and to not be as bad. So it takes about 3 months or less. Education is very important to have in nursing, and wound care is a very important thing too. So I would plan on using quizzes for education in this presentation, with also another educational thing that would be the avatar, which would do the presentation for the students and help that we don't have to do as a presentation. We don't have to do the presentation. I would use the quiz to quiz people on the wounds, and it would be a good source to use for the tools. A timeline for teaching for the students, such as we are going to be doing a week or two of training, such as the first week will be talking about the types of wounds and the stages of wounds. And then the second will be just talking about the scales that are used to learn about the wounds also. There are many resources that can be used for wound care also. We are needing to know like the signs and symptoms of infections, and such as letting the patients know like the signs and symptoms so they can watch for it, know what the drainage is, know what the collar drainage is, how bad it would be if it was this drainage, or when to go to the hospital or when to call their doctor. We need to give them like list of packets and papers showing all these things too. There is other resources such as showing what the scales are for the wounds to use also to see how the patient is at risk at developing a pressure wound. The Braden scale, it shows nutrition, sensation, mobility, and the moisture, which is how you grade and how much risk this patient is going to get the pressure wound. An evaluation that I would use would be to send out to the students on their email to see how they feel about the presentation, and then ask the students questions about the presentation also. So I would send this to on the email and then have them send it back to me. The recruitment, I will have students know the educational plan will be done on a certain date on a piece of paper that will be hung on a board at work, or an email that will be sent to all the students to let them know also. I will also send like an itinerary to let them know and be aware of what the educational plan will be. And it'll be sent into the email also. And it'll tell like what's going to be taught that week or the week after. I will be talking about like communicating the educational sessions to the students by having them in a big room with the presentation on a board with a big projector. And some options that I would choose to do, if anything, would be wrong would be send the projects to the students so they are able to come to this if they aren't able to come to sessions. And that concludes my presentation.